It's time to imagine better health with CHI Health. The drainage, the congestion, the pressure, the pain. It all comes with sinusitis.
You might try over-the-counter or prescription meds to deal with the symptoms, but how do you know when it's time to deal with the problem itself?
Dr. Jessica Moran-Hansen is an ear, nose, and throat specialist with CHI Health. Good morning.
It's nice to meet you.
Good morning. Thanks for having me.
Thank you for coming.
We're heading to that time of year. Whether is it a cold, is it a sinus infection, sinusitis? But how common is this?
It's very, very common. They say up to 1 in 8 adults will actually experience sinusitis throughout the year. So very common. We see it all the time in patients.
So I guess what's happening, and we have a scan here that can help us appreciate what you see on a regular basis in your office.
Exactly. So this is kind of a good scan of, you can tell black is good, it's air, and then on the other side, opposite the black, you see it's completely full of gray in the areas where on the normal side, it's full of the black air. So the gray is the chronic inflammation that can sometimes start to affect patients. And when you get to a point like this is something where sometimes you have to come see someone like me, an ENT surgeon, who can go in there and actually surgically correct this for you.
And I'll tell you what, there's a difference between having sinusitis and a cold. Can you talk about the difference?
Definitely.
Because you know when you have sinusitis, right?
Yes, I would say that symptoms are definitely severe with the acute sinus infection, especially if it's bacterial. We always talk about the nasal congestion or obstruction, just cannot breathe through the nose. You have to have that thick green mucus type drainage going on. You know, just having a little clear drainage is usually not indicative of having a sinus infection. Sometimes you will have the facial pain and pressure. You get over your forehead, your nose, your cheeks, and even your sense of smell and taste can go down if you're having an acute sinus infection.
Is it ever related to seasonal allergies? We mentioned that before the visit started.
Yes, there's lots of people who will have chronic sinus problems and will also have allergies. There are some people that don't have both of them though, so they can definitely be related, but not always.
Yeah, and I guess there are new guidelines about sinusitis. What
Exactly.
are they?
The American Academy of Otolaryngology released new guidelines. There's a ton of them, but some of the most important things we're talking about is trying to decipher whether or not you have a bacterial infection, if it's a viral infection, and whether or not we should be giving all these patients antibiotics, as it's very common that people are getting antibiotics for a sinus infection. They say 1 in 5 antibiotics actually are for sinus infections.
So what do patients do if they're watching now and they say, okay, the guidelines, how do they affect me and my decision making?
Right, so timing's kind of the biggest thing that we look at. You know, during the first 3 to 4 days of having an infection, it's hard to tell whether or not it is a virus, which antibiotics would not treat, or if it's a bacterial infection. So for the first 3 to 4 days, it's hard to know whether or not we should be giving people antibiotics, but there are other things you can do for relief. Something easy to start with is just a nasal saline irrigation. Really helps to clear out the sinuses. I brought a little demonstration bottle.
Before, but that's just
you can use
rinse
a
bottle.
squirt bottle, you can use a neti pot, anything like that. You know, it's been shown to really help to improve some of the symptoms that you have. There's no medication in it, it's just saline, so it's something that you can do without having the side effects of medications.
Any tips for people who've tried it before and didn't succeed?
It takes a little bit of work. I mean, you have to get used to this.
Exactly. We were just talking about how the first couple times can be a little intimidating. It may go everywhere. I always tell people, make sure you're over a sink or in a shower because it could get messy. But do give it a couple times before you give up on it. Sometimes, like I tell my patients, I can do this in 10 seconds flat now. There's no sprayage anywhere. It just takes some practice before you're a professional.
Well, what you do is you tip your head to the side, and then you put the bottle in a neti pot in one nostril, and then it runs through the sinuses, right?
It's
and it comes out the other nostril.
And it comes out the other side. Don't be alarmed if the first couple times it comes out your mouth. Honestly, you will get better at this, and it will just go in one side, out the other side.
It's worth trying.
It is worth trying.
It is. Are there any topicals that you can use?
There aren't. Now, over-the-counter nasal steroids like the Flonase and I believe the Nasacort, you can just get those at your pharmacy, and they've shown that even just a short-term use for when you're having just an acute or attack of sinusitis, they can actually give you some relief, and they're pretty low side effects too.
I have a friend who had surgery on her just last week. But I've known her for a dozen years, and she's always like walking around doing this because the pressure in her face was it was very difficult to function day to day.
Exactly.
I don't know that you need to wait a dozen years, but what do you say to your patients, the point that you'd say, let's investigate surgery here?
Right, so we always say about 3 months. If you're having these symptoms of can't breathe through your nose, you're always holding your face because it hurts so bad, you're chronically draining, you can't smell anything, about 3 months is the time when you really should investigate seeing somebody who specializes in sinus disease. At that time you come to the clinic, we would thoroughly evaluate you for chronic sinus infection, which means that it's not just going to go away like an acute attack. It's something that sometimes we actually have to offer surgery for to get it fixed.
What's the surgery process? What do you do? What do you actually do? I guess it depends on the severity?
It depends on the severity of patients, definitely, but we usually have them come in. Something that I'll use in clinic just to kind of further evaluate their nose is this little scope. So it may look intimidating, but it's actually very small. It's only a couple millimeters in diameter, but this actually allows me to look all the way into the back of your nose. I can see if there's anything wrong with your septum, which is that little divider that separates the right from the left side. I can see where the sinuses drain, see if there's any growths in your nose like polyps or inflamed tissue that we need to address. And then usually after this, we will talk about getting a sinus CT scan that further evaluates the chronic inflammation or swelling in the nose or the sinuses.
Yeah, Mary, that thing looks more intimidating than the neti pot, I'll tell you that. I'd rather have the neti pot any day.
We have some information to show you if you're seeking ear, nose, and throat care with CHI Health. So there's information on the screen now. That website, by the way, we have linked back. So if you don't have time to jot it all down, head to omahamorningblend.com for that link. Also for this clip, if you'd like to watch it all over again or send it to a friend or family member who's been suffering for a while. Doctor, thank you for joining us. A real pleasure to meet you.
Thank you so much for having me.
Treatment options out there.
Always. You do not have to live with chronic sinus problems, which is what I hear constantly.
That's the
for years.
takeaway.
Definitely.
Thanks, doctor.
Thank you.
Thanks for having me.
And international